So today we're going to be doing the first appointment of around 2 to 3 appointments of the root canal procedure. This appointment is just going to basically be taking the root part of your tooth out and filling it with a material called gutta percha. This is just going to act as a filler for that area of the tooth. And then we will go ahead and put a temporary crown on that today. So you will be numb for a couple of hours, like 2 to 3 hours. Just be careful not to bite your tongue, cheek, or lips for that time. And then while the numbness is wearing off, just don't eat anything because that could be really easy for you to bite your tongue or something like that. We did place a temporary crown today. So with that, you just want to go ahead and brush and floss normally, except just be really careful around that tooth, in that area. And when you're flossing, go ahead and just pop the floss down in like normal, but go ahead and only pull the floss out through the sides of the teeth. That way you don't risk popping that crown off. It is common to lose a portion of the filling that we put in or the crown, but as long as the whole temporary crown does not come off, that is completely normal. But if that whole crown does come off, please go ahead and give us a call because our office will need to go ahead and cement that back on. And then just avoid trying to chew on that side. You go ahead and chew on the opposite side. If it is common to have a lot of discomfort or pain in the area for a few days, this should get better, but if it doesn't, just go ahead and give the office a call. And if you notice any swelling as well, go ahead and give our office a call. You can just take ibuprofen or Tylenol, depending on what you want to do for that, and that should relieve most of the pain. But we did prescribe antibiotic for you today, and this, just go ahead and take that until the prescription is gone, just so that can help with that too as well. And then something else you can do to help with the swelling and the pain would be salt water rinsing 3 times a day. Just put a tablespoon of salt in warm water and go ahead and swish that around your mouth gently. And then today, or in our next appointment, we will place the permanent crown. We'll do this as soon as possible. It usually takes around a couple weeks to get that in, but just make sure you do come back for that appointment or get that scheduled as soon as possible, because if we don't get that permanent crown on there, that could risk your tooth fracturing or you even losing the tooth completely. And then just make sure that you let us know if you're experiencing any uneven bite or just feeling any discomfort after that appointment as well. And then do you have any questions for me?
No, you did a great job.
Thank you. And then I'll follow up with detailed progress notes.